Senate Rules Committee. It is about 1:35 p.m. Wednesday, February 24th. Madam Secretary, let's establish a quorum. Please call the roll.
Senators Cannella?
Here.
Cannella here. Leyva? Here. Leyva here. Mitchell? Here. Mitchell here. Runner? DeLeon?
Here.
DeLeon here.
Okay, colleagues, we've established a quorum. We're going to go to file item number 1, which are bill referrals. Can I get a motion? We have a motion made by Ms. Mitchell. Madam Secretary, please call the roll.
Senators Cannella? Aye. Cannella aye. Leyva? Aye. Leyva aye. Mitchell? Aye. Mitchell aye. Runner? DeLeon?
Aye.
DeLeon aye.
Motion passes on a 4-0 vote. I think we're going to keep the roll open for right now. If not, will close it. Okay, we will close it. Motion passes on a 4-0 vote. Let's go to file item number 3, colleagues. 3 through number 11. File items 3 through number 11. If we have a motion made by Ms. Leyva, Madam Secretary, please call the roll.
Senators.
Which one are we on? Files item number 3 through 11. Okay? Okay.
Senators Cannella? Aye. Cannella aye. Leyva? Aye. Leyva aye. Mitchell? Aye. Mitchell aye. Runner? DeLeon?
Aye.
DeLeon aye.
Motion passes on a 4-0 vote. So we'll go straight to file item number 2, which is Karen Smith, MD. This is an appointment by the governor for the position of the Public Health Office, State Department of Public Health. Ms. Smith, welcome. We also have Mr. Dodd from Sonoma. Welcome, Mr. Dodd.
Thank you. Mr. Pro Tem and members?
Yes, once you, I'm making the assumption that you'd like to present Ms. Smith, Mr. Dodd?
Yeah, it is a great pleasure of mine. As a former county supervisor from Napa, I was fortunate to be on the Board of Supervisors when we hired Dr. Smith over 10 years ago as our public health officer and deputy director for the Napa County Health and Human Services Agency. She helped change the culture around public health to one that recognizes and addresses the root cause of poor health and disparities rather than focusing on the disease and illness. Instrumental in improving the county's preparedness and readiness in training and emergency response, this proved immensely important during the H1N1 epidemic in 2010 and 2011 and in the 2014 Napa earthquake. She brought many preparedness resources to our Napa community. Under her leadership, the Live Healthy Napa County Community Coalition achieved success by engaging more than 150 community partners in developing the first ever community health improvement plan, which provides shared priorities for improving health. And I have to say that I know that the best day for Napa County ever, in many respects, is when we hired Dr. Smith. I'm telling you, it was a tough time, and she came through and really did a fantastic job for Napa County. And I also must say one of the lowest days is when she got hired away from the governor of the state of California to here. But we're very, very happy for her and look forward to what she can do for public health in the state of California. Thank you, Mr. Pro Tem.
Thank you very much, Mr. Dodd, and welcome to the Senate Rules Committee. So we'll go straight to Ms. Smith. Ms. Smith, are there any loved ones, any family members, friends that you'd like to introduce?
Yes, thank you, Senator. I have my partner, Louise Whitney, and 3 very close friends, Susie Eastman, Catherine Lewis, and Dr. Poki Namkung, who I have to say during her many years as the health officer for Berkeley was actually one of my original mentors. So I very much appreciate their attendance and support.
Thank you, and welcome. Why don't we go straight to your presentation, and you can share a little about yourself, what your goals are, and then we'll go straight to Q&A.
Sure. Thank you very much.
Thank you.
Thank you, distinguished members of the Senate Rules Committee. I first want to thank the governor for offering me the opportunity to serve in the California Department of Public Health. This is a great honor for me. I have been working in local public health in California for almost 20 years, and during that time I had the opportunity to work with many of the people and programs in the California Department of Public Health. But I know from my own experience, it is a group of incredibly intelligent, passionate people who share my deep commitment to improving the health of the state of California. It's a very interesting time to be coming into the state health department. The field of public health is undergoing a pretty substantial paradigm shift where the mandates of the Affordable Care Act for medical care community to move outside the walls of the clinic and the hospital and start to engage with patients on the very real challenges that they face that keep them from being healthy, and at the same time, our increasing recognition that the really powerful drivers of poor health are the lack of opportunities and the conditions in the communities in which we grow up, we live, we work, and we play. These together have made it clear that public health has to begin to function in a different way. It's really important to us that, to our effectiveness, that we begin to engage with communities that are in the process of working together, working across sectors to really understand what are the drivers of health in that community and how to improve it. And that requires that we at the department find ways to facilitate that, often through the work of the local health departments, but also ourselves in terms of providing leadership and helping in whatever ways we can for those communities to become empowered and to really take ownership of improving health in the community. So thank you. Let me speak to my goals. I have three main goals for my time with the department. First of all, I really want to help move California, the health of the people of California forward. We're using the Let's Get Healthy California goal areas to really measure how we're doing on improving health in California. We will continue to do that work throughout the coming years. In addition, a second goal for me is to find ways for the department to really facilitate the work of local health departments. The local health departments are where the rubber meets the road, if you will. Not only do they actually carry out many of the tasks that the department has been given by the federal government, but they really understand the community, and each community is unique. And so finding ways that we can provide resources to the locals in a flexible manner that allows them to create the perfect system, if you will, for them is very important to me. And then finally, primarily because it helps to facilitate both of those goals, it's important to me to find ways to really improve the business practices of the department. We need to be able to deliver on our responsibilities in a timely fashion with very high quality work. And that requires that we really buckle down and look at some of the administrative issues that the department has faced over the coming years.
Thank you, Ms. Smith. We're going to go to the members, straight to questions and commentaries. We can start off with Ms. Mitchell.
Thank you very much, Mr. Pro Tem. Doctor, I really enjoyed our conversation today. Very much appreciated as a leader of a department, your focus on the administration and the business component of what you do. That's often not very sexy, but clearly not only based on the auditor's report, but just in terms of making sure that you've got an efficient organization that can deliver on its mission. So I really appreciate our conversation and respect you as a leader in terms of your visioning and the culture shift that you're looking to bring to the department. I think that's very important. We also talked about the diversity of all of the different programs that fall within public health, and I'm sure some of my colleagues will talk about environmental issues, licensing, certification. I mean, it's all the things. The one programmatic area I did want to touch bases on a little bit is which will have a direct impact on your ability to be successful with regard to improving the health of all Californians, and that's looking at how we reduce health disparities. As you well know, that there are certain subpopulations that bring your average down significantly. Black, brown, Native American are on the losing end of every health indicator on the spectrum. And so I want to know, within your purview, what it is you think your department can accomplish with regard to reducing health disparities. I know that your public health department doesn't directly fund diabetes, but recognizing the strain it puts on the other leg of the health stool in California between managed health care and Department of Healthcare Services. Where are you on that, and what could we look forward to accomplishing under your leadership in that area?
So thank you for that question, Senator. Actually, addressing disparities, we can't get to optimizing health in California without addressing the disparities. And there are two really broad categories of intervention that are available to us. One category is really addressing directly the disparities, and the other is work to try to improve equity and opportunities to be healthy. With respect to addressing disparities in health outcomes specifically, I think diabetes is an excellent example. We do actually fund 10 communities throughout California with Centers for Disease Control funding for diabetes.
You're the pass-through.
Yes, exactly.
Okay. All right.
So what we're doing in those communities, these are all very vulnerable communities, several African-American communities, Latino communities, that have very high rates of diabetes. What we're doing in those communities is engaging both the community, but also then the healthcare system to try to help engage a conversation with, in particular, healthcare providers around those very real challenges that people have. Diabetes is one of those diseases where in order to manage it well and to improve in terms of long-term outcome, you really do have to address the whole human being and the context in which they're living. And so what we're doing is actually part of the funding that we're providing is for creating systems that will allow both complex, what we call complex case management. That means really going into the home of patients who've had frequent readmissions to hospitals and finding out what those barriers are to their ability to follow the regimen that we think really could be most beneficial. And then providing those services. So wraparound services is a term we use in a lot of places. That means if housing is an issue, we need to engage around housing. If just a general lack of understanding is the issue, then we need to engage around that. If a sedentary lifestyle, lack of exercise is the issue, perhaps we can have promotorious programs where we go in and we really engage in a conversation with the person where they are and around the life that they lead as opposed to the life that we assume that they do. We've been seeing some very early, very exciting responses to these kinds of interventions, and so we're going to continue to fund that. We've submitted a follow-up application for continued funding, and I think that that's one area, and we're doing similar things with the Thousand Hearts campaign for heart disease and hypertension, et cetera. So that's one category of interventions. The other really is to move, we like to say in public health, upstream, meaning move further into the world of prevention. We can have the best possible outcomes for people who have diabetes, but if we don't stop people from developing diabetes in the first place, we're never going to get ahead. So the other category is really looking at the communities in California and the opportunities that are available to particularly children in those communities that allow them to be healthy and to make choices for their families, to make choices that allow those kids to be healthy. This is an area where, for example, obesity prevention, particularly in children but also in adults, is critical to trying to reduce diabetes rates as we go forward. So we are actually engaging both of those conversations, and also in the area of health equity is the issue of cultural competence. So we have, over the past few years, had a number of opportunities to work with local health departments around cultural competence and really understanding the communities that they are working in. So that's sort of an overview of some of the stuff, and we'd be happy to tell you all the other really exciting things we're doing.
I appreciate that, because I think when we as kind of fiscal stewards of the state have to recognize that a day of reckoning will soon come, particularly as you talked about young people.
Absolutely.
When we look at the incidence of diabetes in the Black and brown community of, adolescents and teens. And I can't remember if it's 1 or 2 that you're not born with, but you acquire based on habits. Two.
Yes.
And to hear from pediatricians across the state that when we think about long-term costs, direct costs to the state through our publicly funded healthcare programs, but lost work productivity, it's really approaching a epidemic kind of level of concern. So I think as the public health officer, if you will, for the state, it's going to be, I'm glad to hear that you get it. And even though the state doesn't directly fund in terms of diabetes, that those federal funds are being targeted at the most at-risk communities.
Absolutely. And then we will be following that with very aggressive transfer of lessons learned to other communities throughout the state.
Excellent. Thank you. Appreciate it. Thank you, sir.
Thank you, Ms. Mitchell. Mr. Cannella.
Thank you, Dr. Smith. We had a nice visit a couple hours ago. Just, to talk about some of the things we talked about again, just, for the record, So in 2015, a state auditor's report indicated your department's weak performance and accountability could adversely affect the health and safety of Californians, calling it a high risk. So when I first read that, I was very concerned. Your explanation made me feel better. Maybe you could talk about that briefly.
Sure. So there were two areas in which the auditor determined that the department was high risk. One was emergency preparedness that had to do with the way we were managing the grant. We've actually resolved that, and we've been removed from high risk. The other area is in lab field services. This is a function within our laboratory that actually certifies other laboratories that do clinical testing. And we were not performing the number of surveys of laboratories, so certifications of laboratories should be visited every year or every 2 years, depending on whether it's a federal or state audit. We were meeting our requirements for the federal site recertifications, but not for the state recertifications. And we have done a lot of aggressive recruitment, particularly at the leadership level. That has been one of our challenges, is keeping the technical specialties filled. But we're actually improving in that regard in terms of filling. And we believe that we have a plan in place that will allow us to fully address 5 of the 9 findings of the auditor by the end of this year, and the other 4 within another 6 to 8 months after that. So we believe that we will be able to resolve those issues.
Great. And then we talked about the Zika virus in California. Maybe, obviously it's kind of a scary thing, and it's very close to California in some cases. I guess there's been a couple of cases in the United States. But so what is the department doing, and what do you think the risk is for Californians?
Sure. We actually are doing a lot of work around Zika virus. So first of all, probably the most important thing that we do is our standard job, which is surveillance. Where is it? Is it here? So we have gone from sort of passive surveillance, which means we wait for somebody to report to us, to active surveillance. So we've asked all health departments and all medical providers throughout the state of California to notify us if they see somebody who they believe potentially has Zika virus. And that means either symptoms, returned from a place where Zika is in fact transmitting. And then we have a range. We've just, as of yesterday, we're now fully verified in terms of our ability to do the diagnostic test for Zika virus, particularly the test actually looking for the presence of the virus. So we also are coordinating that testing, the confirmatory testing for people who are not actively sick but think they may have been, and this is especially important for pregnant women who may have been exposed. We're actually working with the CDC directly in terms of making sure that those specimens are verified as whether or not people have in fact been exposed to Zika. We've had we're doing sort of every week to 2 week conference calls with all local health departments as well as with the hospitals and medical providers around when do you worry about Zika virus? If you're worried about it, how do you diagnose it? What other services should be offered? And so we do that on a regular basis. We've issued several health alerts and advisories to be sure that they're up to date. As the CDC has evolved its guidance, we have similarly evolved ours. And then the other thing that we do is California is actually very fortunate. We have very robust mosquito abatement and vector control throughout the state of California. The majority of that's done in independent districts, but we coordinate very well with them. And local health departments work very closely with their mosquito abatement, and the state also coordinates with the vector control community. What's happening right now is in most cases where someone comes back, so far in California we've only had 3 confirmed Zika this year and they're all in travelers coming back. There's been no transmission in California. But what is happening is there are 12 locations in California, 12 counties where we know that the vector, the mosquito that can carry Zika and transmit it is actually present. And they're mostly down near the Mexico border, but also as far north as San Mateo County. But it's very limited in distribution. So we are engaging in much increased surveillance in those areas. And if we do have return travelers who are likely have the virus in their blood, in an area where there is the vector present as well, we will be able to talk to mosquito control and enhance spraying and control activities in the general area neighborhood of those people. So those are some of the things that we're doing. We're also providing a lot of educational materials for physicians who are seeing patients, particularly pregnant women.
Great. Well, and finally, just, I don't need you to answer this, but I was impressed you guys have a succession plan, because as we talked about, 66% of your supervisors and managers are eligible to retire in the next 5 years. That's a large part of the department, so I appreciate all your work on that, and with that, no more
Thank you.
questions.
Thank you, Mr. Cannella. Ms. Leyva.
Thank you, Mr. Pro Tem. Good afternoon, Dr. Smith.
Hello.
Thoroughly enjoyed meeting with you yesterday. You are very smart and well-versed in everything healthcare, so we are lucky to have you in this position, but even more importantly, you seem really excited about it, so that's great because it's a huge job.
Thank you.
Just a couple questions. We're all aware of the terrible attacks that took place in San Bernardino late last year, part of which is part of my district. I'm just curious what role your department would play in a terrorist attack or even a bioterrorist attack.
Certainly. So we've been working on preparedness, particularly for bioterrorism, for many years now. And our role, the State Department of Public Health is a key leader in response to any kind of bioterrorism attack. So I'll talk a little bit about, let me talk first about incidents like San Bernardino, where there's no real disease component to that. However, we still play an important response role. All mental health and behavioral health requests from the counties come to us. And so we've been working closely with the Department of Healthcare Services, Mental Health, and also with the federal government resources in order to make sure that the people in San Bernardino have the resources they need to continue to their recovery, essentially. There are still a number of employees who really just haven't been able to come back to work, so we continue that. With respect to bioterrorism, the state actually plays the lead role in the response, but we coordinate very closely with the Governor's Office of Emergency Services to be sure that we have the full range of resources that are necessary. But depending on the kind of incident, our role could be everything from determining potential exposure, particularly for something like anthrax that does not transmit from person to person. It's very important to get a sense of where the exposure occurred, who might be exposed, and then provide guidance to health departments, to local medical community around what to look for. So that's kind of a sort of 35,000-foot overview of the sort of role that we would play, as well as we're the intermediary with the federal government in terms of making sure that the resources we need are on the ground when we need them to be there.
Excellent. You seem like you have a very good handle on that. I don't know if you saw the article that came out in the LA Times today. Even in sunny LA, warming climate may be the next big public health problem. How do you see your department playing into that?
Well, we have actually been working on issues of climate change for some time now. I think the Zika virus and the fact that we have invasive mosquitoes moving north, these are warm weather mosquitoes that are moving into California. Most of us believe it's clearly in response to the fact that the past years have been warmer, irrespective of why they're warmer. So maintaining that kind of surveillance for diseases that might move with those vectors is really important. That's one of the things that we've been doing. The other really important issue with climate change is understanding what populations are at greatest risk. So if we're looking at, for example, increased heat, we're looking particularly at populations that are less economically advantaged. For example, they tend to suffer more, fewer people have air conditioning, fewer resources to go somewhere else in heat. Often they live in very urban areas and heat islands that don't have good greening, that sort of thing. So one is identifying those types of populations and areas that are going to be affected. The other, though, is to try to develop mitigation strategies for that. And we do have people within our Office of Health Equity in particular that are working on climate change very closely with the Strategic Growth Council and our partners in planning, community planning, and others, so that we can have sort of a concerted approach. So we're all kind of working in the same direction and have the same information to work from.
That sounds great. Thank you, Dr. Smith.
Thank you.
Thank you, Mr. Pro Tem.
Thank you, Ms. Leyva. Just really quickly, I'm reading here with regards to March 2015 last year, state audit that formed both the governor as well as the legislature, and be mindful for, so it stands on the record. Ms. Smith joined the Department of Public Health on March 23rd
Yes.
of last year. It says here that the weak performance and accountability of public health could adversely affect the health and safety of Californians. The auditor labeled the department, quote, a high-risk agency, end quote, due to its, quote, failure to perform required duties, weaknesses in program administration, and because it has been slow to implement recommendations, end quote. Now, I bring this up, and that's why I want to bring very clear clarification for the record, that you assumed the responsibilities of being the director of the Department of Public Health March 23rd, and this, the findings of this audit came out in March 2015. So the question is what has been broached here with issues of disparity, Zika, issues of what climate change may do in terms of weather patterns and the impacts it may have on the public health, particularly in urban areas, and not just urban areas in Southern California and Los Angeles, but as in the Central Valley area too, where there's a lot of vector control programs.
Absolutely.
And obviously issues that tuberculosis, other types of infectious diseases, again, TB, HIV, AIDS. Now, when I hear the words high-risk agency, and the awesome responsibility that your department has in collaboration, cooperation with county agencies throughout the state of California, talk to me about leadership and the necessary cultural changes that have come to fruition or are going to come to fruition to deal with the challenges that are before us.
So the auditor's findings have really point predominantly to the department's history of not handling administrative activities as promptly as they should be. And that's actually it's a really, really important part of what we do. What has happened, I believe, I've not been working for the department since before that, but my impression is that there are very, very smart, passionate public health professionals. The attention has been on exactly those issues that you point out, the more programmatic things, on really addressing the diseases, addressing the disparities, trying to improve health, with, in my opinion, less focus on how do we really have the infrastructure that we need, and is there appropriate oversight for completing those administrative processes, what I think of as the business process. And it's that where I think we've had lack. That's where the department has actually not been performing well. And what we've done is, since I've come, we've expanded resources both in our Office of Legal Services, that's to address largely the regulations, the incredible backlog of regulations, and really engage us, but then also within our own internal audits and compliance departments. From my experience, it's very important that we lay out clearly and transparently, not just for external sake, but within the department, what are our expectations, what are our milestones, who's responsible for those, and then we monitor it, and we monitor it aggressively. And that's the system that we're putting in place within the department, whether it's about budgets, whether it's about clearing audit findings. We're bringing several of the audits that we had been contracting out back into the department so that we can use those resources within the department, within the context of those particularly programs that have had the same audit finding year after year. We are committed to addressing those and clearing those audit findings as quickly as possible. And I do believe that we can do that.
Okay, why don't we go straight to those in support of today's nomination. Ms. Smith, I'm going to ask folks to be very, very brief. Please just state your name, who you represent, in a few words. Those in support, come on up. Don't sit down, Thea. Don't get comfortable. Just I don't want you to get comfortable. Just say, hey, I love Ms. Smith, and she's the greatest thing since sliced bread. Let's move on.
I think you just gave my testimony, Mr. Chairman. Mr. Chairman, members, Theo Peos, Superintendent Hospitals. I can't tell you how impressed we've been with Dr. Smith's leadership of the department. Running a hospital can be very complicated, a lot of complex problems, which we've had. We've had to go to her several times over the year, and every time she took a leadership role and helped us in a collaborative way to solve those problems. So we're very excited about her appointment, and I hope she'll be around for a long time. Thank you.
Okay, thanks a lot, Mr. Pass. Thank you. Next witness in support.
Good afternoon, President Pro Tem, and good afternoon, Senators. Thank you for this opportunity. My name is Stacy Hiramoto. I'm the director of REMCO, the Racial and Ethnic Mental Health Disparities Coalition. We represent underserved communities all through the state in the area of mental health, and we strongly support the appointment of Dr. Smith. We've only met her recently, but we were, as some of you mentioned, we were very impressed with her enthusiasm. But also, we were very impressed because she was familiar with the project that we care most about, that she oversees, which is the California Reducing Disparities Project. And we were very excited that she was committed, and she actually understood some of the concerns that we talked about, and we were, again, delighted because it's a very complex and comprehensive project that really the whole nation is looking at. And it is, we're very excited to be a part of that project. And again, we just wanted to say thank you, and we hope she's approved today.
Thank you. I'm going to re-emphasize again, folks. Please be brief in your comments.
Michelle Gibbons with the County Health Executives Association of California, and we represent the local health departments throughout the state. And we are pleased to support Dr. Smith in her confirmation hearing today. The level of communication and collaboration between the state agency and my members, local health departments, has been fantastic. And it really shows in Dr. Smith's second goal in facilitating the work of local health departments and really forging that collaborative spirit. She has been open and available to our membership. We participate in several calls with both my leadership as well as her staff as well. And we, again, are just in strong support, and we think she's doing a fantastic job.
Thank you. Next witness in support.
Hi, Justin Garrett with the March of Dimes. Want to be here in support of Dr. Smith. She's demonstrated a strong commitment to maternal, child, and infant health, and really a passion for collaborating with partner organizations. So we definitely look forward to continuing to work with her.
Fantastic. Thank you. Next witness in support.
Hi, Kim Schneider on behalf of the California Association of Environmental Health Administrators, also known as CAHA. We are pleased to offer our support today and look forward to working with you.
Thank you. Next witness in support.
Good afternoon, Chair and members of the committee. I'm Dr. David Pro. I'm the Senior Vice President and Chief Medical Officer of the California Hospital Association, representing more than 400 hospitals and healthcare systems in the state of California. Since her arrival, I've had the opportunity to work with Dr. Smith and have been impressed with her enthusiasm, as well as her goal and dedication to optimizing the health and well-being of the people of California. She's really made an extra effort to reach out to stakeholders and have us engaged in a number of issues that are facing the state. And her strong commitment to the improvement activities that she spoke to, we think are critical to the success of the state and the infrastructure that's needed. So for these reasons, the California Hospital Association fully supports her appointment as the next Director of Department of Public Health and Chief Medical Officer.
Thank you. Thank you very much. Next witness in support.
Thank you. I'm Dr. Janet Berryman. I'm the president of the California Conference of Local Health Officials and also the City of Berkeley Health Officer, and I'm here on behalf of CCLHO to express our very enthusiastic support for Dr. Smith, her vision and leadership for really creating and sustaining a strong system of public health that goes all the way through from community members to local public health to state public health to healthcare partners and other partners in order to maximize health opportunities and health equity in California is just very, very exciting to us, and we are thrilled to have her as a leader.
Thank you. You're one of the rare cities that has a public health department. Next witness in support.
Bruce Palmer, representing myself in support of Dr. Smith.
Thank you very much.
My name is Brandon Roberts. I'm here on behalf of the Health Officers Association of California. HOAC has been incredibly privileged to work with Dr. Smith during her time as a local health officer, and we're proud to be here in support. Thank you.
Thank you. Any other witnesses in support? Any other witnesses? Seeing none, those in opposition? Any folks in opposition? Seeing no opposition of Mrs. Smith, any of those would want to make a commentary that are agnostic one way or the other? Seeing none, do we have a motion? We have a motion made by Ms. Mitchell. Madam Secretary, please call the roll.
Senators Cannella? Aye. Cannella, aye. Leyva? Aye. Leyva, aye. Mitchell? Aye. Mitchell, aye. Runner? DeLeon?
Aye.
DeLeon, aye.
Motion passes on the 4-0 vote. Ms. Smith, congratulations.
Thank you very much.
Okay, Sergeant, I'm gonna have to ask everyone to please leave the room right now, Sergeant. We're gonna move into executive session right now.